Hi, everyone. Welcome back to the Health and Wellness blog. As always, thank you for taking the time to stop by to check out the topics of the week. I must admit that this week I was having a very difficult time trying to think of a health specific topic with everything that is going on in our nation and the events that occurred last week. I come to you with a heavy heart full of emotion about all the things that are going on. And in thinking about what I could discuss for this week's blog, my mind just continued to go back to one of the underlying issues in health and the health of our nation as a whole, and that is racism. And so I cannot talk about fostering health of our children in our community without addressing the impact of racism on the health and well-being of our nation as a whole, because it affects everyone, maybe on different levels, but it's certainly something that has to be addressed and has to be talked about. I'm sure that you've heard that racism affects communities in terms of access to care, the quality of care that's provided, and then unfortunately the unconscious bias that some ethnic and minority groups encounter when going through the healthcare system. So it is definitely there. There are studies about it. And in fact, they say that experiences of racism actually increase the risk of emotional and physical health problems. And in looking at the data from the CDC in terms of COVID-19, they have said that the data suggests that there is a disproportionate burden of illness and death among ethnic and minority groups. So it is evident that racism does, and race does play a part in all of this, even in the midst of a pandemic. Furthermore, communities that experience violence and a lack of security also have an impact to their health and well-being. So it not only is just in that community alone, but it does become a public health issue if those underlying issues are not resolved and addressed. And for this week, I actually found that on healthychildren.org, which is sponsored by the American Academy of Pediatrics, they actually put out an article about talking to children about racism. And it's written by two pediatricians and talks about the time is now to talk about racism. Unfortunately, the things that occurred last week have put it on the forefront of our minds, but it's certainly something that we have to discuss with our children and to be transparent about. Pediatricians are saying that they're deeply concerned about the effects of racism on our children, even if it's vicarious racism, which is secondhand racism that can be witnessed through social media, through side conversations with family and friends, because they say ultimately it does harm our children's health. So what can we do? So some of the things that were mentioned to help our children understand what it is to check in with your child. And depending on the age of your child, younger children may not have an awareness of it just yet, and it may not be appropriate to discuss those things. But if your child has an awareness and has heard things on the TV or the media or social media, or even seen different things, check in with them to see what their feelings are, and to discuss it in terms that they can easily understand and that are age appropriate. Also, watch for changes in your child's behavior. A lot of the content that has been on the news and in social media lately is very violent, is very graphic, and those images and those words can create anxiety and also cause them to fear if they are fearing for their safety, those types of things. So make sure you check in with your child to see what behaviors they are exhibiting, and if they need further guidance about how to process those feelings. Also, limit what they see in the media. I mean, it's difficult to even turn on the news without hearing about what's going on, the protests, police brutality, all those types of things, because those images continue to be replayed. So just be mindful of that when you do turn on the TV or look at your phone or on the iPad at news apps, just be mindful of that. Also, be aware to check in with your own emotions. I mean, it's tough. It's tough for us as adults to deal with, and it's even harder for children who may not fully understand what's going on. So be sure that you do self reflection to know what extra resources you may need in order to cope and to deal with some of what's going on, because it is difficult and may take a lot of processing to even be able to talk about it with your child or with another family member. Also, use this as a teachable moment. It's certainly not something that we ever want to have to go through or to have to talk about in these terms and under these conditions, but use it as a teachable moment. So if they ask questions, if they ask for more information, use it as a teachable moment to educate and to help them understand and process exactly what is going on. And then please, please, please tap into our resources. Dr. Natasha has so many great resources, not only from past posts, but she has a plethora of knowledge about how to deal with these types of things, and it's certainly her expertise. We also have on the website, there is a link to our diversity, equity, and inclusion task force, which also has different resources that you can check out, as well as how you can become active or things that you can do during this time. So the next question is, what else do we need to do? And that is take action. So be sure to show your children how to make a positive difference. And so, like I alluded to, on our diversity, equity, inclusion tab on our website, there are links to webinars or books or things that you can engage in with your family members and with your children in order to better educate yourself and to work through and process some of what's going on. Also, help children, adolescents, and young adults know that racism does not just exist, and that it exists, but also that it's up to us to work together to dismantle this. So it's not just, that it exists, but we have to do something about it. Racism is a driver of health inequity and needs to be stopped. So it has to start with us and teaching our children about it and how to dismantle it. So I challenge you to have these crucial conversations and to continue to work through it and process it because it does affect our health, it affects our children's health and our health as a nation. So I want you all to stay well and stay healthy. I won't be continuing to post weekly because I will be transitioning to camp when it reopens, and also our Stepping Stones program. So I am the full-time nurse for both of those programs, and so I won't be on the blog. Dr. Natasha will continue to post things throughout the summer, maybe not as frequently. I'm certainly accessible by email, and I will be checking back in with the student community and Barry community prior to school reopening about all the things that we will have to put in place and guidelines and things like that. So you'll see me again throughout the summer, but maybe not in the form of our health and wellness blog. If things come up over the course of the summer or hot topics, I'll be sure to post those, but it won't be as frequently as what we've been doing during this time of distance learning. I wish you all a healthy and a safe summer, and please reach out if you need anything. Take care, keep washing your hands, social distancing, and using your mask. And like I said, we will get through this together. Take care. Bye-bye.